I just wanted to talk today about the research that I did for my PhD. Unfortunately, it was actually about 9 years that I spent part-time, not 3 or 4. I wish it was only 3 or 4. Felt like it had taken over my life, I have to say. But this was actually some research that I did, initially based at Children's Hospital at Westmead, but also at Sydney Children's Hospital at Randwick. And also then in concert with Royal Children's in Melbourne and Royal Children's in Brisbane as well. So it was a fairly major undertaking and really interesting. I actually really wanted to focus on babies. Infants, to me, infancy is a really important time of life when children are developing their sense of themselves in relation to other people, relationships, and so on, and very much in terms of developing their capacity to regulate their own emotional life as well. And when I started at Westmead, I was looking into some of the literature because I hadn't worked in this chronic illness group before. And what I found in the literature was that some of the studies were saying that there were some behavioural problems that were developing in some older children who had had transplants before. Some of the research pointed out that there was quite a lot of distress for parents, whereas other parts of the research base didn't show that. And it seemed really clear to me that going through a major illness in your child led to a lot of family disruption, and there wasn't really a lot of research that was looking at those particular areas. I also noticed that fathers just hadn't been included in the research that was published at that point in time, which I really felt was a major omission. One of the concerns that I had working in a children's hospital was that they often feel to me places which are very focused on mums and kids, and I think that can be quite a feeling of exclusion for fathers, and I was really keen to try and get fathers' perspectives as well. And so then I started to think about, well, look, if we actually looked at babies who'd been diagnosed with liver disease, would it be possible for us to look very early on and see what might be predicting some of those behavioural problems that people are finding down the track, with the aim that if you can find something that's predicting that, maybe there's something that we can do early on to try and prevent that from happening. So it was my PhD research project, and what I wanted to look at were all of these different elements here. So trying to get a bit of a measure of how stressed parents were feeling following the diagnosis in their child. What was the impact from parents' perspective of the illness on their family? How involved fathers had felt that they were able to be, particularly in the medical care of the kids, and whether some of those family characteristics were able to predict how well the babies were doing about a year down the track. So I wanted to look very early on in the course of the illness, and usually what we find, if there's been any kind of major stress for anybody, it doesn't matter whether it's a diagnosis of an illness in your child or you've had a car accident or something like that, everybody goes through a major transition period where they have acute stress symptoms. And so I wanted to actually get through that first 1-2 months where everybody would be really highly stressed, and then actually look at 3 months when people had had a bit of time to get used to the idea that their baby had been diagnosed with this illness. I ran a series of questionnaires, and I'm incredibly thankful to all of the families who participated, because they spent something like 3/4 of an hour, I think, filling in the questionnaires for me. And there was a series of them. One was asking parents about what kind of stress symptoms they had. Another was asking them about how their family usually functions. A third was asking them to talk about what impact the baby's illness had had on the family specifically. And the fourth was asking about father's involvement in the care of the child. The fifth one there I actually didn't ask initially. I asked that at the follow-up period a year down the track, because that was my outcome measure, which was asking about the child's emotions and behaviour. And on both occasions, so we did this twice, and make that very clear. Firstly, 3 months after the diagnosis, and then about a year down the track. And we also did a parent interview, and that went from anywhere for about 30 minutes up to about an hour or so for some families. And I did that on both occasions as well. And the point of the parent interview was to ask, I met with mums and dads together and asked them about what their experiences had been and how their child's illness had affected them as a family. So 42 families actually participated in the study, and that was from all of those 4 different hospitals that I was talking about. 37 of those completed both parts of the study, so I thought that was actually a reasonable size group of parents to give a really good overview. Really interestingly, all of the babies were within the normal limits in terms of the questionnaire that I asked about how they were doing emotionally when they were about 18 months of age or 12 months down the track. But what I did find was that there was actually some links between some of those measures that I was looking at and how well the infants were doing. So if you look at the results from the infant questionnaire, what you find is a whole range of responses. So although the babies were all within the normal limits in terms of how they were going emotionally and behaviourally, there was a range of different outcomes for those infants. And the things that were predictive of how the kids were doing was firstly if their illness was particularly severe, and I measured that by the number of visits that the children had to make to outpatients, and also the number of days that children had to have in hospital throughout the period of time as a measure of how severe their illness was. Diagnosis was also important, so babies who had biliary atresia actually tended to have better outcomes on the emotional measure that I used, whereas babies who had other illnesses tended to have higher scores on that particular questionnaire. And the final thing that predicted how well the kids were doing down the track was parents' perceptions of the impact of the illness on the family. So parents who said, this illness has had a really big impact on our family, their children tended to have higher scores on the emotional and behavioural outcome scale. The interviews were really interesting. The families spoke with me. I recorded the interviews and then I transcribed them, so I typed out what people were saying, and then I did an analysis of the major issues that families were covering during those interviews as they were discussing how they felt about the impact on the family. And really I managed to, I think that the kind of common things between the family were these 6 areas that I've identified here. All families spoke about the difficulty of those feelings of uncertainty. Uncertainty was something that was present really throughout the whole course of that 12-month period, starting right from that period of time when their child was first unwell and they realised that their child was unwell and not knowing what was wrong, going through that whole period of diagnosis, which was also full of uncertainty, and then worries and uncertainties about the future, what kind of treatment was being required for their child, and so on. Families were also incredibly aware of the level of vulnerability for their baby, and the sense that they really felt that they needed to be able to protect their baby. And I think that sense of vulnerability also really fed into the difficult feelings around uncertainty that families had. It also added to a sense of isolation that many families spoke about. So people talked about other people not really understanding the kind of experience that they were going through as a family, being disconnected from family and friends and their usual supports if they had to come into the hospital. Some families had to travel interstate as well, so they were completely disconnected from all of their usual kind of supports. And while you're in the hospital, quite often fathers had to go off to work, mums were there in the hospital, so they were even separated just from each other during that period of time, feeling very isolated. Having to keep everything else going in life, and particularly if there are other children in the family, so trying to keep all of that going at the same time as you're trying to look after your baby while you're in the hospital, really hard for families too. But on the flip side, families also spoke about the shared experience that they had. Parents shared the experience with each other, and many families talked about it bringing their relationship together. But also meeting other families who had children who had liver disease, enormously important for families too. But then the other thing that really came out of the research was the way in which people adjusted over time. Everybody had to make adjustments. You can't just keep going as you are. So there's a kind of enforced adjustment, but families also told me, we've got a really different perspective on life now. And I actually thought that there was amazing resilience in the families that I spoke to. I looked particularly at fathers because of the issue that I mentioned before, that fathers were really unrepresented in psychological research in this particular area. A lot of fathers spoke about the need to keep work going, need to keep the family going, and this could be really difficult for a lot of fathers because they were kind of away from the hospital, relying on their wives to tell them what had gone on during the day, so not necessarily hearing information firsthand, which I think was really hard for mums and for dads, because mums were then feeling the pressure of trying to kind of answer dad's questions and give accurate information and have they remembered everything and all that kind of stuff. But also fathers talked about feeling that to some extent, for some of them, not all of them, but being able to go to work and get some outside stimulation actually really assisted them, because it was a distraction from what was going on at the hospital. And many fathers said, look, it's much harder for mum because she's there the whole time having to deal with this, whereas I can actually take some time out and have some normal life and then come back again. Some fathers felt really excluded by the hospital experience, and I think that was incredibly hard for fathers, not quite knowing how they fitted in and where they fitted into the hospital experience, sometimes feeling that there wasn't even a place for them there, which was incredibly hard for fathers to take, I think. But they really also really appreciated being involved in the research and found talking through the issues really supportive. I then took a look at the interviews that I'd done and what people talked about, and combined that with the questionnaires as a way of trying to analyse that information kind of in an integrated way. And what really came out of that, I think that's fairly unique from this study that hasn't been shown in other research, is that the families who reported a particularly great impact on the family of the illness actually also said that they didn't have enough family support from extended family members. So that's actually quite a new finding, because in general with psychological research what we find is that people talk about social support being very protective, and it is, we know that. But what was really interesting to me was that in this research, all of the families talked about having friendships that were very supportive, having support from the other families who had kids with liver disease, and almost all of the families had a lot of extended family support as well. But for those who didn't have extended family support available, maybe that was because family lived a long way away, weren't able to be supportive for one reason or another, those families were all in the group who actually scored higher on the impact on the family scale, which was just demonstrating, I think, that it was lacking that support was actually incredibly important for those families. Those families also who said that they were struggling to adapt to the illness also tended to have higher scores on that particular questionnaire. And money problems were incredibly common, I have to say, because people were taking time out of work. Quite often mums had not been able to return to work after maternity leave, so there was quite an adjustment to make with that. All of those kind of expenses that you get from being in hospital a lot, so all the things you don't think about, like having to buy meals all the time, having to pay for car parking, all of that kind of stuff. Sometimes medications are expensive and so on. And that also really increased the impact of the illness on the family too. So I thought to try and kind of draw that together and just say, look, what can parents actually do to try and manage all of this? I think really to ask for support is really important. Sometimes people, family, friends, don't actually know what's required. They don't know how to provide support. They don't know what it is that you want. And to be able to kind of be fairly forthright about that and to talk to people about, well, this is what we need at this point in time, is really important. We try and offer support from the social worker or the psychologist at the hospital, and that's not about kind of saying, gosh, there's something abnormal for you guys going on here. It's actually about trying to see what needs to be in place to try and help families to cope with the kind of stress that they're going through. And I think the kind of thing that we were just hearing about. Catching up with other liver families, as people sometimes talk about, which I think is actually really supportive. Including fathers in the baby's care at hospital, and making sure that we do welcome fathers into the hospital and help them to feel that they are a really important part of it, because I think that that's part of the family structure that children need, but dads need to be there and mums need to be there too. And then making sure that you look after yourself, taking rests, taking breaks, making sure that you get enough exercise, do all of those kind of stress relief things. And if things are getting on top of you, to actually seek some treatment for that. That's all I wanted to say. Thank you.